Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment for a disease known as stroke, also known in simple terms as hemiplegia or paralysis. Now, paralysis or stroke is a medical condition in which damage or dysfunction of the various parts of the body occurs due to pathology in the brain, which results either from a diminished blood flow or bleeding in the brain. Now, this reduced blood supply is more common, it is nearly 80-85%, and bleeding is quite rare, comparatively 15%. The blood supply to the brain vessels is usually reduced because of atherosclerosis or blood clots known as emboli. The symptoms of paralysis or stroke include weakness or paralysis of limbs, paralysis of muscles of the face, difficulty in speaking, coordination problems, giddiness, and problems with vision, sudden headache, and loss of consciousness. Now, depending upon which part of the brain is affected and how much the severity is, paralysis can result in monoplegia, which affects one limb, hemiplegia, which affects upper and lower limb on one side, and paraplegia, which is where the paralysis affects both the lower limbs. Now, acute paralysis is a medical emergency and usually needs to be treated in the intensive care of hospitals in order to avoid serious complications and death. But once the acute stage has subsided, then Ayurvedic herbal treatment needs to be initiated at the earliest, possibly within 3 to 4 days of the paralytic attack, so as to obtain maximum benefit from treatment. Ayurvedic herbal treatment for paralysis or stroke includes both oral medication as well as localized therapy. Now, local therapy is in the form of application of medical oils, fermentation with medical decoctions, and massage with various herbal ointments and pastes. Local therapy helps in stimulating neuromuscular junctions and in strengthening the muscles and tendons. This treatment also provides stimulus to the brain and nerves to heal at the earliest. Oral medication is initially provided to heal the damage in the brain and reverse the pathology of the condition. Since an ischemic attack results in reduced blood supply, Ayurvedic herbal medicines are given to treat atherosclerosis and blood clots if present. In case of hemorrhagic paralysis, treatment is given to heal and soothe damaged arteries and capillaries. Further treatment is given to heal damaged nerve cells and to help in the process of regeneration. Treatment is then continued in order to rehabilitate the affected individual, minimize the damage, and bring about recovery to the maximum extent possible. Graded exercises and physiotherapy are also a must, along with oral medication and massage. Now, depending upon the extent and severity of the paralysis, most affected individuals will usually require treatment for periods ranging from 2 weeks to 6 months. Usually 2 weeks is quite rare, at least 1 month treatment is required, but 1 to 6 months may be required depending upon the severity. Now, in addition to the treatment which I have described so far, we can also give some specific or some unique treatments for the ischemic type or for the hemorrhagic type. Now, for the ischemic type, usually Shirodhara and some other types of Panchakarma treatments are given. For the hemorrhagic types, Rakta Mokshan in the form of leech therapy is quite useful, and it can reduce the blood clots at the earliest. So, this combination of oral medication and local massage and Panchakarma treatments, also medicated enemas, Basti treatment also may be given. So, this combination is overall quite effective in treating all the different types of paralysis. The duration will depend upon the severity. So friends, this is a short description of Ayurvedic herbal treatment for paralysis. Let's meet in the next video. Goodbye.